Impact SRC, Deakin University Centre for Innovation in Mental and Physical Health and Clinical Treatment, researches patterns of chronic disease, risk factors and novel therapies for psychiatric, musculoskeletal and metabolic disorders. With a focus on the link between physical and mental health, talented staff and students are working towards improving health and well-being through research that is driven by innovative techniques and thinking. We are located at Barwon Health in Geelong's CBD. This positioning allows us the unique perspective of working at the clinical research interface and to expand our extensive network of collaborations. We engage directly with the local community, health services, industry and government. Our success has given the Impact SRC local, national and international recognition.
In Impact's Epicentre for Healthy Ageing, we have a division focused on psychiatric epidemiology. This group explores the links between physical health and mood, anxiety and personality disorders. The group utilises one of the nation's longest running population-based cohort studies. The Geelong Osteoporosis Study began researching osteoporosis in 1993 and has since expanded to explore a variety of physical and mental health issues. Examples of this work include studies of mood, anxiety and personality disorders associated with increased risk of other medical conditions such as bone disease, cardiovascular disease, diabetes, gastrointestinal diseases and inflammatory disorders. We hope that this research will achieve improved assessment and treatment and will generate education programs that raise awareness of the risk and ways of achieving better health for Australians.
The Social Epidemiology division within Impact's Epicentre for Healthy Ageing is interested in the social determinants of health in the Geelong region and beyond. We are exploring how our health is influenced by where we are born, live and work. With few exceptions, social disadvantage leads to poorer health outcomes, reduced access to health services and different levels of health literacy. Social disadvantage also influences our ability to seek, use and understand health information. Lifestyle behaviours, for example smoking, physical activity and diet, are influenced by social factors, all of which influence our susceptibility to disease. We are collaborating with healthcare providers, policymakers and governments to address differences in health status and risk factors between different social groups.
Impact's Nutritional Psychiatry division focuses on the connection between diet and health, both mental and physical. We're particularly interested in exploring the biological pathways linking food and the brain. Inflammation plays an important role in mental health, and so does the gut microbiota. And by examining the links between diet and health in the population, we can identify targets for intervention. By running randomised controlled studies, we're also able to examine how people with depression respond to improved diets. And we're also influencing policy by advocating the importance of preventing mental and physical disorders and promoting health to policymakers.
Impact SRC is interested in developing and assessing interventions for better health. Our Clinical Trials division explores pharmacological interventions for a range of mental illnesses. We are interested not only in providing new treatments, but also use blood samples to explore biological pathways. Using integrative research and innovative techniques, we are hoping to discover the biology that underlies these disorders. We also have a program of research investigating online therapies for those with mental illness. This approach is not only innovative, but with our current technological climate, is very accessible and easily taken up.
Complementing our interventions program, we also explore drug safety, using a wide variety of data sources including randomized controlled trials, epidemiology and medical data. We investigate safety profiles of medications and produce associated safety guidelines.
My experience as a postgraduate student within Impact SRC has been excellent. I feel that I've benefited from the collaborative and supportive environment. I was originally interested in being part of the Impact SRC because the research projects being offered suited what I was particularly interested in. I was also interested in continuing to work with Professor Pascoe and Dr. Brennan due to their expertise. My study has examined vitamin D deficiency during pregnancy and the impact on the child. I've gained hands-on clinical experience and had access to the latest technology, specialised training and world-class supervisors. Impact has provided me with many great opportunities to present my work at national and international conferences and I now feel confident that I'm prepared for a successful research career.
With a large and talented group of over 50 researchers and students, we're promoting the recognition and importance of good mental and physical health. Taking a wagon wheel approach of multidisciplinary research, we conduct projects across the full spectrum, including epidemiology, basic and clinical science, interventions, and the interplay between these paradigms. We're passionate about our research and our continued ability to impact clinical practice and health outcomes, locally, nationally, and internationally.